this webinar that's part of our Spring Safer Chemistry Challenge Program webinar series. My name is Cindy McComas, and I am a co-project manager for NPPR's Safer Chemistry Challenge Program and also an adjunct professor at the University of Minnesota. Today's webinar is co-hosted by NPPR's Pollution Prevention Policy and Integration Work Group. This webinar helps advance the goal of NPPR's Safer Chemistry Challenge Program, that is to motivate, challenge, assist, and reward companies as you work to find safer alternatives to chemicals of concern to human health and the environment. The Safer Chemistry Challenge Program is a unique partnership between industry, states, and nonprofits. And this challenge program can help you to accelerate opportunities to expand your customer base and capture emerging markets for products with safer chemistries, turn your commitment to safer chemistry into an action plan as shown on this diagram, increase workforce safety and ensure the health of consumers, achieve cost savings with a better understanding of the ever-changing chemical regulatory landscape that we'll hear more about in this webinar, and finally utilize resources such as technical assistance programs and recognition programs. Much of what will be covered in this webinar is included in a new NPPR report entitled State Chemicals Policy, Trends and Profiles, and everyone on this webinar was involved in helping put that report together. I'll direct you to a website at the end of the webinar for the report. Our webinar today is entitled State Profiles and Chemicals Policy Implementation, and will provide you with information to help you advance your efforts towards safer chemistries as part of your sustainable business program. States in the U.S. are taking the lead in chemicals policy, resulting in a regulatory landscape that's changing and can be difficult for companies to navigate. The webinar will provide an overview of current state legislation from Maine, Minnesota, and Washington State with different perspectives from across the country. You will learn about the many strategies and approaches that are being used in legislation, including chemicals of concern, restricted substances lists, targeted sectors, and products and alternatives assessment tools. But before we begin, and before I introduce the speakers, I have just a few logistics to cover. So during the webinar, all attendees will be on mute. If you have questions, please submit them through the Submit Question option in the chat window that GoToWebinar provides. Questions will then be answered at the end of the webinar instead of at the end of each speaker, because we have 3 speakers today. We would very much like to hear from you about how this webinar helps meet your company's program needs to move towards safer chemistries. So at the end of the webinar, you'll receive a survey, and we hope that you'll fill it out and provide us with some feedback. Now to introduce our presenters, we have 3 speakers for today's webinar, and I will introduce them in the order that they will be speaking. Carrie Malinowski works for the Maine Department of Environmental Protection, Bureau of Remediation and Waste Management. Carrie brings the unique perspective of having implemented one of the nation's only state mandated chemicals use in consumer products reporting programs to the discussion. Kathy Odell is second, and she has worked for the Minnesota Pollution Control Agency, or MPCA, for more than 17 years as a hydrogeologist. Related to this webinar, her current responsibilities include implementation of the Minnesota Toxic Free Kids Act, participation in the Interstate Chemicals Clearinghouse, or IC2, and tracking development of state and federal chemicals policy initiatives. Carol Craigie is third, and she has worked for the Washington State Department of Ecology for more than 30 years. Again, related to this webinar, Carol is coordinating toxics policy in the agency, including managing the state's PBT initiative and implementing the new Children's Safe Products Act. So let's begin the webinar with Carrie Malinowski from Maine, to be followed by Kathy Odell from Minnesota, then followed by Carol Craigie from Washington. Thank you, Carrie.
Thanks, Cindy. Good afternoon, everyone, and thank you for joining us. My name is Carrie Malinowski, and I'm with the Maine Department of Environmental Protection. I'll be providing a summary of Maine's toxic chemicals and children's products law for you, sometimes referenced using a different title in error. Here at the department, we refer to it as the Safer Chemicals Program. Within that program, we are responsible for chemical prioritization, i.e. listing, managing the reporting of regulated chemicals by manufacturers, compliance enforcement related to that program, and rulemaking also related to the overarching regulation. Maine has a tiered approach to prioritizing chemicals. In 2008, the Maine legislature instructed the department to establish a chemical listing hierarchy, which has evolved into the tiered system shown here. This tiered system provides for a reliable and thorough review process, as a chemical does not become promoted unless it meets the base criteria first. And you can see here that we have a base of chemicals of concern, and from that listing we move to chemicals of high concern, which we call the CHC list, and then priority designation. So we begin with that large base list referenced as the COC, and at this point we have just over 1,300 chemicals on that list. From that base, chemicals are what I call promoted to the high concern status. To date, we have 49 chemicals on that list, and then the final tier is priority. A chemical on the CHC list may be promoted to priority status, which then invokes the department's regulatory authority. All of the department's chemical prioritization work is done in concurrence with the Maine CDC. So how does a chemical become part of our base tier? A chemical needs to have been identified by an authoritative governmental entity on the basis of credible scientific evidence, which is defined for us in statute, and in part that definition allows us to rely on authoritative federal or international governmental agencies, and it needs to meet the following, one of the following three criteria. It is either designated as a CMR or endocrine disruptor, it's persistent, bioaccumulative, and toxic, or very persistent and very bioaccumulative. Next slide, please. From that base list, the department and the Maine CDC undertake a review to determine which of the more than 1,300 chemicals of concern warrant promotion. And we look for one of these criteria to be met. It's found in biomonitoring studies, found within the home environment, or it is in a consumer product. Now, the department worked in consultation with the Maine CDC to investigate the evidence for these listing criteria, and in July of just last year, we published the current list of 49 chemicals of high concern. We were very fortunate to be able to utilize the work of the Washington Department of Ecology in focusing our efforts for this tier. We reviewed Washington's list of 184 potential chemicals of high concern for children, matched them with our chemicals of concern, and then we accepted Washington's assessment for that phase and further applied Maine's credible scientific evidence standard to develop our list of 49 chemicals of high concern. And while there are several areas where our regulations overlap, that being Washington State and Maine, Maine's authorizing law has certain requirements that differ from Washington State. And at the time that we undertook this effort, Washington's literature search was somewhat dated by that point. And so if you were to review our process documentation, which we have on our Maine DEP website, and certainly I invite you to go and take a look at that, you'll see a much more detailed look at how we developed this list. But you'll see that we also expanded on Washington's references, and some of the lesser-known sources that we were able to find include the German Federal Environment Agency and a database called SPIN, which is the Substances in Products in Nordic Countries database. And so with that expanded reference point and utilizing the framework that we have in Maine statute, we have a CHC list that is 67% similar to Washington State. So we have some overlap there. Next slide, please. The final tier of prioritization comes after a chemical has met the listing criteria for both the COC, that larger list, and the high concern list. The department and the Maine CDC then makes a determination that more information is needed about how the chemical is used. So priority designation provides us with the authority to require reporting information from manufacturers that use priority chemicals, and also includes the authority to require that manufacturers of certain products submit an alternatives assessment report. At this time, Maine is the only state with that authority and the only state to have implemented this requirement. Priority status for chemicals is established through routine technical rulemaking, and it's at that time that product categories for reporting are determined. Currently, we have, as I've mentioned, 2 priority chemicals. They are BPA, NP, and NPE. Our reporting deadline for those chemicals was in October of 2011, and in a couple of subsequent slides, I will review those results for you. Next slide, please. So why designate to that 3rd tier? It's only at that level that we can mandate the disclosure of use information, and it's at this tier that the department can then make it obligatory for manufacturers to disclose whether safer alternatives are available. And finally, that priority designation provides a framework for pursuing a sales prohibition. And the importance of the use information is that the department has found that there's an absence of publicly available information detailing chemical use in consumer products. And so we would seek to have the information directly from manufacturers. And with this, then we're able to make more informed decisions on whether to pursue additional regulation, such as the sales prohibition. Currently, Maine does have a sales prohibition in effect for reusable food and beverage containers that contain intentionally added BPA. Next slide, please. So this slide shares with you the results of our chemical reporting to date. On the left, you see a 3D image of a BPA molecule, and chemical formulas for both chemicals are on either side. Some of the product categories that were established when BPA was designated as a priority chemical include toys, child care articles, and tableware. As you can see, we had 18 manufacturers report to us the use of BPA in 305 categories and/or products. This is one of the ways that our reporting is similar to Washington State in that we do allow companies to report to us utilizing a GPC code system. And so we allow them to report in a category, and we ask for additional product identification information. So that's why you see that categories and/or products. For NP and NPE, we had 14 manufacturers report to us. Some of those product categories that were required for reporting were cosmetics and personal care products, household and commercial cleaning products, as well as home maintenance products. And as you can see, we had almost 400 categories and category products reported to us. And so another similarity that we have with Washington is that we also provided them a form, although ours is in a basic Excel spreadsheet, but we had some very similar information that we were looking for. However, a significant difference is that we asked for manufacturers of all sizes to report simultaneously. And so you see here that these are the manufacturers that sell these products within the state of Maine. Maine did pursue the enforcement of the alternatives assessment requirement, which was required for 2 specific product categories. With that final alternatives assessment report and a citizen petition to initiate rulemaking, the Board of Environmental Protection has at this point provisionally adopted a sales prohibition on packaging which contains intentionally added BPA and is used for infant formula and baby food. That provisional rule is major substantive, so it still needs to be voted on by the legislative body, and if passed, it could go into effect in March of next year. Next slide, please. So that concludes my summary. We had a limited amount of time, but if you have additional questions and as questions come up, please feel free to call or email me. If you are part of the state government considering a similar regulation, don't hesitate to contact me. There is undoubtedly some experience I can share from stepping in front of the bus first, so that might save you some headaches. If you're in the regulated community, please don't hesitate to contact me with your questions as well. I can add you to my email distribution list of interested parties so that as updates or changes are made, you remain informed and have the opportunity to be an active participant. And with that, I will pass it over to Kathy Odell, who will now walk us through Minnesota's program.
Okay, thank you, Carrie. Thanks for your presentation. And yes, we're turning now to Minnesota and Minnesota's Toxic-Free Kids Act, which was enacted in 2009, a year after Maine and also Washington's legislation was passed. When Minnesota's Toxic-Free Kids Act was originally proposed, it included several of the elements that are included in Maine and Washington's legislation. But when it passed, it was reduced in scale and included only some of those original provisions. Next slide, please. So let's see. So in a nutshell, Minnesota's Toxic-Free Kids Act required development of a list of chemicals of high concern that is very similar to Maine's list of chemicals of concern. And from this list, selection of a subset of chemicals called priority chemicals. A key point is that in Minnesota, there are no regulations associated with the chemicals of high concern or the priority chemicals. The list exists, and the list of chemicals of high concern is to be reviewed and updated at least once every 3 years, but there are no specified actions associated with the chemical list. Next slide, please. Oh, excuse me, wait 1 minute. I'm missing a slide, but the Toxic-Free Kids Act also required preparation of a report for submittal to the Minnesota legislature providing recommendations about mechanisms to reduce and phase out the use of priority chemicals in children's products and promote the use of safer alternative chemicals, and also promote consumer product design that uses green chemistry principles and considers a product design over its life cycle. This report was completed in December 2010, about 7 months after passage of the Toxic-Free Kids Act. Okay, now you can move on. Thank you. Another aspect of Minnesota's Toxic-Free Kids Act that is different from Maine and Washington's legislation is that responsibility for implementation of the Act is shared between the Minnesota Pollution Control Agency, the agency I work for, and the Minnesota Department of Health. The Department of Health and its staff of toxicologists was given responsibility for developing the chemicals of high concern and priority chemical lists, and the Pollution Control Agency was given responsibility for developing the report and recommendations required in the Act. For much of the rest of this presentation, I'll focus on Minnesota's specific criteria for identification of chemicals of high concern and the selection of priority chemicals. But I'll also present the recommendations made in the December 2010 report, provide highlights of current legislative activity in Minnesota, and touch on related activities that have been undertaken by state agencies with regard to priority chemicals. So the definition of chemicals of high concern, oops, can you move back, please? The definition of chemicals of high concern in Minnesota's legislation is very similar to the definition of chemical of concern in Maine's legislation. It requires that a chemical of high concern be identified on the basis of credible scientific evidence by a state, federal, or international agency. Okay, next slide. Then, the chemical must be suspected to cause developmental harm to a child or fetus, be carcinogenic or genotoxic, endocrine active, or possess other harmful characteristics outlined in the Toxic-Free Kids Act statute. Next slide. With this definition and other requirements contained in Minnesota statute, the Minnesota Department of Health developed a process to yield a list of chemicals of high concern by the statutorily required date of July 1st, 2010. As Maine statute is very similar to Minnesota's, and Maine published its list of chemicals of concern in the summer of 2009, just as the Department of Health was beginning work on this task, the Department of Health reviewed Maine's list and determined that many of the chemicals on Maine's chemicals of concern list would be appropriate for the Minnesota chemicals of high concern list. Consequently, the Department of Health used Maine's list as a basis for development of Minnesota's list. The Department of Health began by removing chemicals from Maine's list that are excluded from the provisions of the Toxic-Free Kids Act, which for the chemicals of high concern was primarily pharmaceutical chemicals. 320 chemicals were removed. Next slide. The second key step in developing Minnesota's list of chemicals of high concern was necessitated by the requirement that priority chemicals, which must be selected from the list of chemicals of high concern, be high production volume chemicals as identified by EPA. Since there's no single list of high production volume chemicals, and for a variety of other reasons I won't go into due to time, but are fully documented on the Department of Health's website, the Department of Health developed a strategy to identify high production volume chemicals that meet the chemicals of high concern criteria. Next slide. Quickly, the Department of Health queried EPA's inventory update reports for the previous 20 years and identified a universe of 4,700 odd chemicals. Since it was not feasible to review such a large number of chemicals, the Department of Health used a system involving a union of high production volume chemicals appearing on the 2006 inventory update report and 3 of the 4 previous inventory update reports. Next slide. This yielded a total of 1,895 chemicals. Next slide. Which the Department of Health then reviewed to determine their eligibility for inclusion on the chemicals of high concern list. The outcome was the addition of 443 high production volume chemicals to the developing list of chemicals of high concern. Next slide, please. The Department of Health also reviewed other sources and selected additional chemicals to add to the list, such as Minnesota's health-based guidance, the European Union REACH's substance of very high concern list, and so forth. The list was published as required on July 1st, 2010, and included a total of 1,756 chemicals. Next slide, please. Of more interest to many of you is the definition and process for selection of priority chemicals. By the Toxic Free Kids Act statute, priority chemicals must be selected from the chemicals of high concern list and found in either human tissue, the home environment, for example, air or dust, or in fish, wildlife, or the natural environment. The Toxic Free Kids Act required that priority chemicals be identified by February 1st, 2011. Next slide, please. Because of the high production volume requirement, the Department of Health began by screening the 443 high production volume chemicals that were added to the list of chemicals of high concern to eliminate any that could be excluded under the Toxic Free Kids Act statutory definition or would be prominent in categories of consumer products excluded from regulation under the Act. This would include electronic products and components, food and food or beverage packaging, medical devices, and so forth. Again, the process used by the Department of Health and exclusions are fully documented on the Department of Health's website for those of you interested in further detail. Then the Department of Health considered, whoops, back up please, the statutory requirement that priority chemicals be present in human tissue or the home or natural environment. Health considered the overall intent of the Toxic Free Kids Act to protect children from exposure to toxic chemicals and products designed for them or in their home environment, and reviewed additional sources of toxicity information. Ultimately, next slide, the Department of Health, in consultation with the Pollution Control Agency, selected 9 priority chemicals. Let's see, I think you need to advance one, please. Which were published on January 31st, 2011. They include 2 metals, 2 flame retardants, bisphenol A, formaldehyde, and 3 phthalates. Next slide, please. Here are some links on the Department of Health's website where you can access more detail and information about both of these lists. And note also that the Department of Health plans to publish updates to the list of chemicals of high concern on July 1st, 2013. All right, now getting to the legislative report that was required by the Toxic Free Kids Act. This report was completed almost 2.5 years ago and is available on the MPCA's website. In it, as required, the Pollution Control Agency makes recommendations about mechanisms to reduce and phase out the use of priority chemicals in children's products and promote the use of safer alternative chemicals, and also promote consumer product design that uses green chemistry principles and considers a product's design over its life cycle. Next slide, please. So key recommendations made in the report are as follows. Primary recommendation was that manufacturers that produce or sell children's products in Minnesota that contain one or more priority chemicals be subject to reporting requirements. We were envisioning a reporting system similar to that in effect in Washington in order to provide information about priority chemical use in children's products. This information is necessary to identify opportunities and guide future policies directing reduction of the use of priority chemicals. Reporting can also serve as an incentive for manufacturers to reduce their use of priority chemicals. We'll hear more about Washington's experience with this in just a minute. In addition, we recommended that state agencies develop educational materials so that Minnesotans will have context about the potential hazards, risks, and routes of exposures to priority chemicals and can be empowered to reduce their exposure of priority chemicals if they so choose. And finally, we recommended that state agencies participate in the Interstate Chemicals Clearinghouse and states' initiatives that support reform of the Federal Toxic Substance Control Act. In both cases, these actions allow Minnesota to learn from other states that are implementing chemical policy and add its voice to states that are encouraging federal policy reform. Now, the last item is really a full half of our report that I'm not going to go into in this presentation, but I do want to make note that the Pollution Control Agency has been very active in using its existing resources to work with Minnesota industries to reduce their use of priority chemicals and also to encourage awareness and application of green chemistry principles in their work. I've included contact information for those of you who are interested in finding out more about this activity at the end of this presentation. Since it was enacted, the Toxic Free Kids Act has not been amended. However, this session, legislation was introduced and heard in committee that would have modified the Toxic Free Kids Act by adding reporting requirements and the eventual phase-out of priority chemicals in children's products sold in Minnesota. This proposal is no longer active. But we have two other bills that are proceeding, one that would introduce restrictions on formaldehyde and one on bisphenol A in children's products. Next slide. I'd like to end by noting that though Minnesota does not have regulations associated with its priority chemicals, both the Pollution Control Agency and the Department of Health are engaged in activities relating to the education and phase-out of priority chemicals in consumer products. The Minnesota Pollution Control Agency is using its pollution prevention grants to address priority chemicals. We have two current active projects focusing on formaldehyde and flame retardants in building products, and another on bisphenol A and thermal paper receipts, and numerous other green chemistry and design projects. The Department of Health has, through its Contaminants of Emerging Concern program, has developed information sheets containing health-based guidance for 3 Minnesota priority chemicals. So far, these are for BPA, dibutylphthalate, and benzylbutylphthalate, and they are working on information sheets for D2-ethyl hexylphthalate. And that, next slide, please. Here I've provided contact information both for myself, Al Innes, who's our green chemistry guru here at the PCA, and David Bell, my counterpart at the Department of Health. Thank you very much, and Now Carol Craigie from the Washington Department of Ecology will present on Washington's legislation.
Thanks, Kathy and Carrie. My name is Carol Craigie. I've worked at Department of Ecology for a long, long time. And currently I'm working on toxics policy almost exclusively. So if we can go to the first slide, I'll just jump in. I thought I'd give a little context on the other kinds of laws. I'm going to spend most of our time today talking about the Children's Safe Products Act, but there are a number of other laws that we have on the books that I think Minnesota and Maine also have some of these types of product laws that limit certain chemicals of concern for a variety of types of products, both for human health exposures and for the environment. So lead in wheel weights is an environmental concern, but BPA is a human health concern. So that's pretty self-explanatory, but there's a number of things that have been implemented in the state. So if we want to talk a little bit about the Children's Safe Products Act, we can move on. It was passed in 2008 after the summer of the recall the year before. And what it did was two things. It limited the amount of lead, cadmium, and phthalates that can be present in children's products. That piece of the legislation was substantially preempted later that summer by the passage of the Federal Consumer Product Safety Improvement Act. And looking at the preemption, our lead standard is almost entirely preempted, but that's not true of cadmium or of phthalates. There are products that are covered by our standard that are not covered by the federal standard, particularly things like cosmetics. So we are looking at that, but we've spent most of our time developing rules to implement the reporting requirements, and that standard was for the Department of Ecology to work with our Department of Health, come up with a list of chemicals of high concern for children, and then manufacturers of those products would report on that use to us. It doesn't go any further as Maine does, but it does get us with we have a pretty large list. So we could move on. The products that are covered by the Children's Safe Products Act are very explicitly defined. Toys, cosmetics, and jewelry, and there's a definition in the rule about what those are. Children's clothing, car seats, and then a broader products intended to help a child eat, sleep, relax, pretty much child care products. And there's a long list of excluded, very explicit excluded products that include things like batteries, video games, toy steam engines, lawn darts, roller skates, a whole big list of things that are not considered covered by this law. So if we can move on to how you've seen or you heard from folks today about how we came up with this list. All three states have approached it in similar ways with differences in our various statutes. What our law does is it establishes criteria for a high priority chemical, and those are the toxicity characteristics that include, I think they're identical to what Kathy put up from Maine. Or from Minnesota, I'm sorry. And then so what we did was we went to authoritative sources, similar definition, and came up with a list of 2,044 chemicals that we considered had been listed by somebody else as meeting the characteristics in the law for toxicity. The law also provided guidance on where the potential for exposure would be, and that's focused on things like it's in a biomonitoring study, it's in house dust, it's in the water, it's in commonly used consumer products. And so we went to the literature and found every chemical we could find that would meet those criteria. And we looked at the overlap, and that overlap was the initial potential list of chemicals of high concern. We had 476 chemicals. However, at that time, the law doesn't say much about how many you should have, but the governor did. And so she said, you will have about 50 on your initial list. So we knew we had to move from 476 down quite a bit. So we began by eliminating chemicals for other purposes. You've heard similar prioritization. I'm sure you've heard these kinds of things, but we eliminated things like pesticides, combustion byproducts, things that were regulated by in other ways, and we got it down to 185. And then we still had to continue to reduce, so we worked with the Pediatric Healthcare Specialty Unit at the University of Washington, and they helped us come up with an algorithm to focus our attention on endpoints that were really important to children. So we ended up with cancer, reproductive and developmental toxicants, and endocrine disrupting compounds. So that's where we focused our energy on, and we got it down to 66, which I contend is about 50. So if we want to move on, thinking about the requirements for reporting, who has to report are manufacturers, and the law has a broad definition of a manufacturer. And so in our rules, we created a little hierarchy to explain it. If you are a manufacturer of a children's product and you have a U.S. presence, then you're the person who has to report. If there is no U.S. presence of the manufacturer, then it's either the importer or the distributor, and it can be a trade organization on behalf of a manufacturer. What they have to report is intentional use of a chemical above, and its detection limit's not quite right, it's really the practical quantitation limit, which we established in guidance. So you have to report if you are intentionally using a chemical and it serves a function in the final product, then you have to report above that practical quantitation limit. If the chemical is present in a product as a contaminant, meaning it does not serve a purpose in the final product, then you have to report it if it's present at above 100 parts per million. That was a pretty controversial part of our rulemaking, but it's produced some interesting results. And we also put in the rules that you do not have to report if you have a program in place a manufacturing control program in place that is designed to minimize the presence of that contaminant. So if you have 200 parts per million of a contaminant present and you can demonstrate to us that you have in place a program and you use it diligently to minimize the amount of contamination, then you don't have to report. The report itself is, we have created an online database, and everything in there is a drop-down menu, so there's not a lot of wiggle room. You have to report the chemical and the CAS number, the function, which we have on a list, and the material or the component that you're reporting for, and the concentration in a range. And what we've asked manufacturers to report is the highest concentration for each component in a BRIC. And the BRIC is, Carrie referred to this as the Global Product Classification System. And it's their standard identification of stuff, I call it, the big dictionary of stuff. And we just incorporated that into our rules. So a BRIC is the lowest level, and examples of BRICs are there, art supplies or stuffed animals. So if you make many stuffed animals, you are only going to report for each component the highest concentration that you see in that category or BRIC level of products. So that's what is reported. We did phase in the reporting system. We had a lot of concern locally that smaller manufacturers and particularly smaller importers would be particularly hard hit. We do not require that people test. You can use process knowledge, but really small companies were struggling with this, and so we phased in the reporting so that the largest manufacturers reported first, and we created a tiered reporting system in which manufacturers of products that are likely to have the most exposure, so for baby products, rubbed on the skin, placed in the mouth, marketed to kids under 3, those products reported first. So we can move on. So let's look at the next slide. So here's a little bit about what we've seen so far. In our phased-in reporting system, we've had 2 rounds of reporting. So we've had the largest manufacturers, which are manufacturers of $1 billion or more in sales, have reported on the baby products I just described, but also on the next category, which is essentially clothing. Although we've received reports, some companies decided last year they would just report on everything. So we have kind of a smattering. The largest function, the largest by far is we don't have a function, we're present as a contaminant. And then it looks like pigments and dyes are going to be a significant user of toxic chemicals of concern, as are plasticizers and preservatives, which of course are by definition of concern. And then we have some reports on things that are added to plastics or polymers, and then stabilizers. So those are the functionalities that we're seeing. You can move to the next slide. You can look at this a different way. Is the top 20 chemicals that are reported. By far, the top 2 are cobalt, which no one expected, and ethylene glycol, which is a precursor we now know to the production of polyester. So and antimony is associated with flame retardants, and I don't know what molybdenum is used for. We have not dived into this data yet. We will do that in the fall after we have the largest manufacturers report on the 3 tiers. So the next tier is toys, and they will report in August. And at that point, we will look at the data in more detail. We can go to the next slide and look a little bit in a little bit more detail. The red circles are associated with the contaminant, or the coloration. So those are pigment and dye additives. Keep going. If you could add the next set, is the green is plasticizers, things that are added to plastics. A lot of phthalates we see there. And then I think we have one more. These are the preservatives, so parabens that we're seeing, but not a lot of them. So that gives you a sense of a little bit of what we're seeing. I want to just spend a couple of minutes talking about what's next for us. We could move on. As I said, we're going to be analyzing the data in much more detail in the fall after we have 3 rounds. Our intention is to look at the way things are made as opposed to individual products. So we cannot see, and you can't look at our data and say it's Barbie's hair that's the problem. You can't look at that. By component, by brick, doesn't really allow for looking at individual products. But we can look at the things that make up the supply chain, and our hope is that we'll be able to identify where there's opportunity and need for safer alternatives. We have ongoing compliance efforts. We have been lucky enough to get a couple of grants to do product testing over the last year, so we've done quite a bit of that, which is it's a new media for us, and so it's required quite a bit of method development from our lab and other, just us trying to figure out how do we do this. And you don't have to take your hazmat class to go into Walmart to buy stuff. So it's just a very different set of testing that we're doing from environmental media. We've done testing around bisphenol A and PBDEs because we have laws on the books around those 2 chemicals. And then we've done a lot of testing around about half of our list of chemicals of high concern for children under the Children's Safe Products Act. We're in the process of developing a database to put our product data in. Right now it's sitting in a spreadsheet, which is scary for us. So, and then lastly, we are looking at that 476. There's other chemicals that need to be added. We have been petitioned 3 times on this rule since it's only 2 years old. So we are thinking we really need to have a regular update of the list. Next is a little bit more of our moving away from the whack-a-mole. We could have the next slide, please. We've looked at a lot of chemicals individually, and we are hoping with the Children's Safe Products Act to move away from that. Some individual chemicals that are still being debated here. We had a flame retardant bill dropped this year on chlorinated phosphates, the TDCPP and TCEP flame retardants. That bill is still alive even though we're in special session. It didn't pass during the regular session, so we'll see. And we have some work that we are biting off on PCBs and pigments, which is another whole story. But we have some quite a bit of 303D listed water bodies that are listed for PCBs, and we're finding that the sources are not all legacy, that PCBs are associated with pigments, particularly yellow pigment, and there are still significant sources in things like recycled paper streams. So we're looking into, what can we do there? We have participated and led an effort with 7 other states to develop guidance on safer alternatives and how you assess them. And we've also gotten a little bit of seed money from EPA to develop a green chemistry center here in the Northwest. There's a lot of work going on in Oregon, and we want some of it. And then we've had 2 pieces of work that we've continued to work on, where we've pulled together stakeholders to look at a more systemic, non-whack-a-mole way of looking at toxics reduction and what makes sense from a state perspective. We had a white paper that was out for public comment, and I haven't had time to do much more with it since that comment period closed. And we continue to work on federal TSCA reform. So that's all I've got. There's some contacts on the next slide. And if you're interested in how we came up with our list or the more specifics about all that, can be found under the website where the Children's Safe Products Act there. So that's all I have.
Okay, and now we'll move on to questions. This is Kim Richards with the National Pollution Prevention Roundtable, and I'll be relating the questions that were asked during the webinar. Please continue to ask any questions that you might have in the questions box. Also, just a reminder that the slides will be made available on NPPR's website after the presentation. Our first question comes from Glenn House. He asks, are these reporting requirements only required for children's products? Carrie, do you want to talk about that first?
Sure. First, I would like to address a little bit of history. It seems that Minnesota was able to utilize a list of chemicals that Maine had produced in 2009. In 2011, there were some statutory updates to the law, and we did end up removing the pharmaceuticals and the pesticides from our larger list, that base list of chemicals of concern. In January of 2012, we republished that list. And so if you were noticing some of the numbers being a little bit different, that's why. We removed those pharmaceuticals and the pesticides to come down to about 1,300 chemicals on our list. So regarding the product categories that we look for reporting on, we do look to establish reporting requirements for children's products. That is defined in our law, and children's products are consumer products that are intended for use or marketed for use by children under the age of 12. We have some examples of that. We also have, with that, a subsequent definition for consumer products, and those are any items that are sold for residential or commercial use. And so as you see, what appears to be an expansion of the idea of a children's product for the NP and NPE use, that being personal care products, household and commercial cleaning products, and home maintenance products. The idea behind establishing those product categories for reporting included the idea that children could be exposed to the NP and the NPE from those products as they are used in the home environment, used in daycares, and so on. So that's how we come about having those product categories listed.
Kathy or Carol, did you have anything to add to that before we move on to the next question?
Well, this is Kathy, and in Minnesota we have no reporting requirements at this time.
And this is Carol, and for ours it's very explicitly limited to children's products as defined by the statute.
Great. Our next question. Do any of the state's legislation require that an alternative assessment is used, and if so, which tool is encouraged? Carrie, do you want to start again?
Yes, we do have criteria listed for an acceptable alternatives assessment. Those criteria are listed in rule and published on our website, and that is at the DEP. It's maine.gov and DEP, and then through the DEP you would look at programs and find our rules listed there. We do identify an evaluation methodology, and that is the green screen evaluation methodology, or another evaluation methodology that is approved by the department. So while we do name that one particular hazard screening method, there is the opportunity that at some point another method could be approved by the department for use.
Kathy?
Yes. Well, again, Minnesota's Toxic Free Kids Act has no associated regulations at this time, but I would add that we are participating in the Interstate Chemicals Clearinghouse and participated in Washington State's lead project in developing some alternatives assessment guidance. So we are tracking and cognizant of the issue, but we have no regulations regarding alternatives assessment in Minnesota.
And Carol, do you have anything else?
Yeah, this is, in Washington, the Children's Safe Products Act as it currently exists does not go beyond disclosure. There's been some discussion at the legislature, but so far nothing's been passed that requires alternatives assessment.
Great, thank you. One more question. Can you share what kind of non-governmental partners are supportive of your legislation, such as NGOs, industry sectors, and chambers of commerce? Carrie, did you want to start?
Sure. We have an open door policy. We like to sit down with all interested parties. And so I would say, while there are aspects of the law and proposals that not everyone agrees upon, there are some aspects that the interested parties are supportive of. And so I would say, without going through our list of those that are interested in it, we sit down with all sides every time that there is something on the table that could potentially lead to a change in either the law or implementation.
Kathy, would you like to add from your state?
Yes, well, I guess I would say that the legislation that's on the books currently was driven by the NGO community. Healthy Legacy was a key driver of this legislation that's passed the Toxic Free Kids Act in Minnesota, as well as organizations like Safer States, Preventing Harm Minnesota, Clean Water Action, Institute of Agriculture and Trade Policy. And the legislation that was introduced this session was spearheaded, again, by those organizations. However, the agency did participate in providing some recommendations to those organizations in development of next steps for the Toxic Free Kids Act. And I think that's where we have been at this point in terms of the active players in this state.
Carol, do you want to talk about Washington at all?
Oh, okay. The Children's Safe Products Act was pushed by the Washington Toxics Coalition, and they continue to be big supporters of pushing forward. But as we developed our rules, we were able to work pretty closely with a number of industry groups from across the country who were really interested in making sure that the reporting requirements ended up being workable, that, and I think we ended up with some really good relationships established there, that it led to the way we structured our rule, and I think we got some great input there. So it's really been a pretty collaborative effort on many sides, although I think, you know, Carrie put it well, there's lots of people who still really dislike this legislation, but it's on the books, and I think we've implemented it in a way that most in the industry appreciate. So.
Okay, and I think we have time for one more quick question. What do you think about minimum levels for chemicals of concern compliance? What about contaminants? Carrie, did you want to start on that?
So is the question regarding thresholds for reporting and establishing thresholds for reporting? Is that what you gather?
I believe so.
Okay. So what do I think about it? I think that's a tricky question. It's a very contentious issue, and it really depends on the chemical. You know, there could be, you know, a safe level for one chemical that is not safe for another. So here in the state, following the framework that we have to work from, we utilize the practical quantification limit, which is a reporting limit, and that can be, you know, challenging to work with also, but at this point it is the best we have. I think that's a discussion that is to be had on a chemical by chemical basis, and requires a significant amount of effort and investigation.
Well, this is Kathy in Minnesota. I'm going to defer to Maine and Washington on this point, since we are not implementing a reporting program in Minnesota.
Lucky you, Kathy.
Well, this is Carol. Carrie said it very well. I think it's problematic to assume that there is a de facto number you should just use. 1,000 parts per million is usually put forward. We've sort of moved that to 100 parts per million, but it's just not it doesn't, as Carrie said, it's not related to the chemical then. And for some chemicals like lead, there is no safe level. So, you know, it's assuming that that exists and that model of toxicity exists for every chemical is false. So I agree with, well, the way Carrie said it was well done.
Great, thank you. And I'll hand it over to Cindy to finish out our webinar.
Thank you, Kim, and thanks for all the great questions. We appreciate your attendance today, and I want to thank Kim for all logistics and monitoring of helping us put on the webinar from NPPR. And final, especially thank you to our excellent speakers today. We had a very full hour from Carrie Malinowski from Maine, Kathy Odell from Minnesota, and Carol Craigie from Washington. Hopefully gave you a great perspective on chemical policy legislation across the country. And also thanks to the P2 Integration Policy Work Group of the National P2 Roundtable. And so I wanted to direct you to the NPPR report I mentioned earlier. State chemicals policy trends and profiles can be found on the website on this slide. So feel free to look it up. If you just go to p2.org, you should find a link to it. Also want to remind folks to please complete the survey that you will receive following the webinar. We really value your input, and it will help us come up with ideas and content and changes for our fall webinar series. This is the last webinar in our spring series of the Safer Chemistry Challenge program, but we will keep you informed about the schedule for the fall series. Webinar slides should be posted on the NPPR website at p2.org sometime, I would guess, in the next week or so. So be sure to check back if you want to look back at anything that came up during this webinar. We have a number of events coming up of the Safer Chemistry Challenge program in September and October. We will be putting on a green screen training that is supported with our Great Lakes Restoration Initiative grant from EPA in September in Indianapolis, in conjunction with a joint Indiana NPPR P2 conference. Will be held in Indianapolis on September 25th and 26th. And then we will be having another green screen training in Buffalo, New York in late October. We don't yet have a date for that, but we will get that information out to you. We also hope you'll check out our website at p2.org/challenge and become a member of the Safer Chemistry Challenge program. And please do contact us with any questions at saferchemistry@gmail.org or .com. Sorry. So thank you again for joining, and enjoy the rest of your week.